Many people pay close attention to their diet, medications, blood pressure, cholesterol, and blood sugar, but they often overlook something they do every single night: the way they sleep. It may sound simple, but for middle-aged and older adults, sleeping position can affect breathing, circulation, nighttime blood pressure, sleep quality, and even how clear your mind feels when you wake up in the morning. Of course, it would not be accurate to say that one sleeping position alone will definitely cause a stroke. Stroke risk depends on many factors, including age, high blood pressure, diabetes, heart disease, high cholesterol, smoking, obesity, lack of physical activity, sleep apnea, and family history. But here is the important point. Some nighttime habits can quietly make your heart, lungs, blood vessels, and brain work harder for hours while you are asleep. And if you are over 60, those hours matter. If you often wake up with a headache, dizziness, a stiff neck, a racing heart, shortness of breath, numbness, brain fog, or unusual fatigue, do not immediately dismiss it as just getting older. Sometimes your body is trying to tell you that your sleep is not truly restoring you. And one of the first things to look at is your sleep position, your pillow height, the timing of your dinner, alcohol use before bed, and the environment in your bedroom. In this video, we are going to look at 5 sleep-related habits that older adults should be careful with. Then I will show you 2 sleep positions that may be more supportive for circulation, breathing, and brain health. Finally, I will give you practical steps you can use tonight to sleep more comfortably, breathe better, and wake up feeling lighter and more refreshed. Before we begin, ask yourself one question. How do you usually sleep? Are you a back sleeper, a left side sleeper, a right side sleeper, a stomach sleeper, or do you curl up tightly in a fetal position? Your answer matters because it may help you understand which habits are helping you and which ones may need to be adjusted. The first habit to pay attention to is sleeping completely flat on your back with no elevation at all. Many people believe lying flat on the back is the best sleeping position because the spine looks straight and the body feels balanced. For some young and healthy people, that may be perfectly fine. But for older adults, especially those with high blood pressure, poor circulation, breathing problems, reflux, or frequent nighttime headaches, lying completely flat may not always be the best choice. When you lie completely horizontal for many hours, gravity is no longer helping your circulation in the same way it does when you are standing or sitting. In younger adults, blood vessels are usually more flexible and the body can adjust more easily. But as we age, blood vessels often become stiffer, and the cardiovascular system may not respond as quickly as it once did. If you already have high blood pressure, poor circulation, snoring, or possible sleep apnea, lying flat on your back may make breathing problems, snoring, or pressure sensations in the head more noticeable. Some people say they wake up in the middle of the night with a heavy head, a dull headache, pressure around the forehead, or pain at the base of the skull. Others sit up in the morning and immediately feel dizzy or lightheaded. They need to sit on the edge of the bed for a while before standing. These symptoms do not automatically mean your sleeping position is the cause, but they are signs that deserve attention. The body gives signals. The question is whether we are willing to listen. A simple adjustment is to slightly elevate the upper body. This does not mean stacking several pillows under your head. That can bend your neck too far forward and create a different problem. Instead, the goal is to create a gentle incline from the upper back to the shoulders and head. For many people, raising the upper body about 15 to 30 degrees may help breathing, reduce snoring, ease reflux, and make sleep feel more comfortable. You can use a wedge pillow, an adjustable bed, or a careful pillow setup that supports the entire upper body evenly. The key is this: do not bend the neck sharply. Support the whole upper body. The second habit to consider is sleeping on the right side for long periods, especially if you have heart disease, heart failure, high blood pressure, or nighttime palpitations. Now let me be very clear. Not everyone who sleeps on the right side is in danger. Many healthy people sleep on the right side without any problem. But if you already have cardiovascular issues, sleeping position may affect how comfortable your chest feels, how stable your breathing is, and how your circulation behaves during the night. The heart sits slightly to the left side of the chest. When you lie on one side, pressure inside the chest can change. The position of the heart, lungs, and major blood vessels can also. The third habit to avoid is stacking too many pillows under your head. Many older adults sleep with 2, 3, or even 4 pillows. They believe this helps them breathe better, reduces acid reflux, drains the sinuses, or makes them feel more supported. And yes, some elevation can be helpful, but the problem is how that elevation is created. If you stack several pillows directly under your head, your neck may bend sharply forward, your chin moves closer to your chest, your shoulders tighten. The muscles at the back of your neck stay under tension for hours. This can lead to morning neck pain, stiffness, headaches at the base of the skull, shoulder tightness, and even numbness or tingling down the arms. For people who already have cervical spine arthritis, chronic neck pain, dizziness, or nerve irritation, poor pillow positioning can make symptoms worse. Your neck is not just a structure that holds up your head, it is also an important passageway for blood vessels, nerves, and the airway. When the neck is bent or twisted for many hours, your body does not fully relax. You may think you slept for 7 hours, but you wake up tired, sore, and mentally foggy. That may be a sign that your sleep position is creating stress instead of recovery. A good pillow does not have to be expensive. What matters is whether it supports the natural curve of your neck. When you sleep on your side, your pillow should be high enough to keep your head, neck, and spine in a relatively straight line. When you sleep on your back, your pillow should not push your head too far forward. It also should not be so low that your neck drops backward. If possible, choose a pillow with gentle cervical support or a memory foam pillow that supports the neck without forcing it into an unnatural angle. Here is a simple rule. Do not elevate your head by stacking several small pillows. If you need elevation for reflux, breathing, or snoring, elevate the entire upper body with a wedge pillow or an adjustable bed. That creates a smooth incline instead of sharply bending the neck. The fourth habit is sleeping in a tightly curled fetal position. This is one of the most common sleeping positions, especially for people who feel anxious, cold, or who like the feeling of being protected. In this position, the knees are pulled close to the chest, the head is tucked forward, the back is rounded, and the arms are pulled in tightly. At first, it may feel comfortable and safe, but if you stay tightly curled for the entire night, your body may run into two problems. The first problem is restricted breathing. When your back is rounded, shoulders are closed, and knees are pulled high, your chest and abdomen may become compressed. You are still breathing, of course, but each breath may be shallower than it should be. For a healthy person, this may not seem like much, but for someone with lung disease, asthma, COPD, obesity, heart failure, sleep apnea, or age-related decline in lung capacity, shallow breathing through the night may contribute to morning fatigue, heaviness in the head, or poor mental clarity. The second problem is muscle tension. The neck, upper back, shoulders, and hips may remain contracted for hours. The body is supposed to release tension during sleep, but in this position, it may stay curled up as if it is protecting itself from something. By morning, you may feel shoulder stiffness, back pain, neck tightness, or numbness in the hands because nerves or blood vessels were compressed during sleep. If you like sleeping on your side, you do not need to give it up completely. Instead, turn the tight fetal position into a more relaxed side sleeping position. Gently lengthen your body. Keep your spine more neutral. Place a pillow between your knees to reduce pressure on the hips and lower back. Hug a body pillow in front of your chest so your upper shoulder does not collapse forward. This still gives you the comfort and security of side sleeping, but it gives your lungs, heart, spine, and neck more room to relax. The fifth habit is not exactly a sleeping position, but it has a powerful effect on sleep and circulation, going to bed soon after a large meal or drinking alcohol close to bedtime. Many people eat dinner late, especially a heavy meal with rice, bread, meat, fried foods, or dessert. Then they watch television for a while and go straight to bed. Some people also drink beer, wine, or liquor in the evening because they believe it helps them sleep. At first, alcohol may make you feel sleepy, but the sleep that follows is often lower quality. You may wake up during the night with a dry mouth, pounding heart, sweating, headache, or restlessness. When you eat a large meal, your body sends more blood and energy to the digestive system. The stomach becomes full. Acid reflux becomes more likely. The diaphragm may be pushed upward, which can make breathing less comfortable when you lie down. For older adults, especially those why, now that we have talked about habits to be careful with, let's answer the more important question. What should you do instead? The first position many people can try is left side sleeping. For some people, especially those with acid reflux, sleeping on the left side may reduce nighttime burning in the chest. Because of the way the stomach and esophagus are positioned, lying on the left side can make it harder for stomach acid to move upward. If you often wake up with heartburn, a sour taste in your mouth, coughing at night, or burning discomfort behind the breastbone, left side sleeping may be worth trying. From a circulation standpoint, some people with heart-related symptoms also feel more comfortable on the left side. But again, this is not a universal rule for everyone. Every body is different. If you have left shoulder pain, certain lung problems, or a complex heart condition, left side sleeping may not feel right for you. That is why you should listen to your body and speak with your doctor if you have serious medical conditions. The correct way to sleep on your left side is not to force your body into a stiff position. You should be comfortable. Your shoulders should not feel crushed. Your neck should be supported. Your back should not be overly rounded. A body pillow in front of you can help keep your upper body stable. A small pillow between the knees can keep the hips and lower back aligned. If your shoulder hurts, adjust the angle slightly. You do not have to lie perfectly on your side at a 90-degree angle. If you have been sleeping on your right side or your back for 20 or 30 years, do not expect to change overnight. Start slowly. Lie on your left side when you first get into bed. If you roll over during the night, that is normal. The goal is not perfection. The goal is to gradually spend more time in a position that feels easier for your breathing, circulation, and spine. The second position is back sleeping with gentle upper body elevation. This may be helpful for people who have nasal congestion, reflux, snoring, difficulty breathing when lying flat, or shoulder pain when sleeping on the side. But remember, gently elevating the upper body is not the same as stacking pillows under the head. You can use a wedge pillow, an adjustable bed, or a setup that raises the upper back, shoulders, and head together in one natural line. A 15 to 30 degree incline is often enough for many people. This position may help keep the airway more open, reduce reflux, decrease the feeling of heaviness in the head, and make breathing feel easier for some people. If you have lower back discomfort, try placing a small pillow under your knees. This can reduce pressure on the lower back and help the spine rest in a more natural curve. Some people call this a zero gravity or pressure relief position. The upper body is slightly elevated, the knees are slightly bent, and the body is supported evenly. For older adults, people with back pain, or those who wake up sore, this position may be worth testing. However, back sleeping is not right for everyone. If you have moderate to severe sleep apnea, sleeping on your back may make the airway collapse more easily and worsen snoring or breathing pauses. If your family says you snore loudly, stop breathing during sleep, gasp suddenly, feel very sleepy during the day, or wake up with morning headaches, you should talk to a healthcare provider about a sleep evaluation. Do not simply change pillows and ignore the problem. Sleep apnea is an important risk factor for high blood pressure, heart disease, stroke, and memory problems. Beyond position, your bedroom environment matters too. Your bedroom is not just where you sleep. It is where your heart, brain, blood vessels, and nervous system either recover or continue to struggle. First, temperature. A room that is too warm can make it harder for your body to cool down. Your heart rate may stay higher. Your sleep may stay lighter. You may sweat, wake up often, or never reach the deeper stages of sleep. For many people, a cooler, well-ventilated room supports deeper sleep. You do not need to follow an exact temperature if it does not fit your climate. The key is to avoid a hot, stuffy room that keeps your body working all night. Second, reduce blue light before bed. Phones, tablets, televisions, and bright overhead lights can send the wrong signal to your brain. Your brain may think it is still daytime. Melatonin, the hormone that supports sleep, may be delayed. You lie down, but your mind is still awake. Your thoughts keep moving. Your body does not shift smoothly into sleep. After 9 p.m., try to reduce screen time. If you must use your phone, lower the brightness and turn on night mode. Better yet, put the device away earlier and let your brain wind down naturally. Third, pay attention to noise. Even noises that do not fully wake you can pull your brain out of deep sleep. Each time that happens, your heart. One of the most important parts of healthy sleep is learning how to read the signals your body gives you. Many older adults are used to tolerating discomfort. A headache is blamed on age. Dizziness is blamed on standing up too fast. Fatigue is blamed on poor sleep. Neck pain is blamed on stress. But if these symptoms repeat, especially in the morning, you should not ignore them. A simple sleep journal can be very helpful. Each morning, write down a few things: what time you went to bed, what time you ate dinner, whether you drank alcohol, what position you remember sleeping in, whether you woke up during the night, and how you felt in the morning. Did you have a headache, dizziness, numbness, tingling, chest discomfort, shortness of breath, brain fog, neck pain, morning fatigue? After 1 week, you may start to see a pattern. Maybe reflux happens when you eat late. Maybe your heart races when you drink alcohol. Maybe your neck hurts when you use 2 pillows. Maybe you snore more when you sleep flat on your back. Maybe you wake up clearer when you sleep slightly elevated. These patterns matter. Some people may also use a smartwatch, sleep ring, or overnight pulse oximeter. These tools do not replace a doctor, but they may provide useful information. If your oxygen level drops repeatedly during sleep, if your heart rate changes in unusual ways, or if you have loud snoring with breathing pauses, you should speak with a healthcare professional. Do not self-diagnose, but also do not ignore the signs. And now, an important warning. If you ever experience possible stroke symptoms such as face drooping, weakness or numbness on one side of the body, trouble speaking, sudden vision changes, severe dizziness, loss of balance, confusion, or the worst headache of your life, call emergency services immediately. Do not wait to see if it gets better. Do not lie down and sleep it off. With stroke, time is brain. The sooner treatment begins, the better the chance of recovery. But before a crisis ever happens, there are many things you can do every night to support your health. The good news is that healthy sleep changes do not have to be complicated. You do not need to transform your entire life overnight. Start with one small habit and repeat it consistently. Tonight, you can begin by eating dinner a little earlier. After dinner, take a gentle 10 to 15-minute walk. Before bed, reduce screen time. Make the room cooler and quieter. Check your pillow. Is your neck bent forward? Are your shoulders tense? Is your head supported naturally? If you struggle with reflux or breathing when lying flat, try gently elevating your upper body. If you sleep tightly curled up, try a body pillow to help keep your side sleeping position more open and relaxed. If you sleep with 3 pillows, try switching to one properly supportive pillow. If you go to bed right after dinner, create a 3-hour gap between your last large meal and sleep. If you drink alcohol at night, try reducing it and avoid drinking close to bedtime. If you wake up tired every morning, keep a sleep journal for 7 days. The most important thing to remember is this: sleep is not just the time when you close your eyes. For adults over 60, sleep is when the body repairs blood vessels, stabilizes blood pressure, restores the nervous system, regulates hormones, supports memory, and prepares you for the next day. A good night of sleep does not just make you feel rested, it supports your heart, your brain, your circulation, and your quality of life. Health is rarely built from one miracle solution. It is built from small choices repeated every day. A better sleeping position, a better pillow, an earlier dinner, less screen time, a short walk after meals, a cooler bedroom, paying attention to warning signs, seeing a doctor when symptoms do not feel right. These simple steps may not look dramatic, but they are the kind of habits that protect your health over time. If this information helped you, share it with a parent, grandparent, friend, or anyone over 60 who wakes up with headaches, dizziness, shortness of breath, neck pain, or unexplained morning fatigue. Sometimes one small change in sleep position or nighttime routine can help someone breathe easier, sleep deeper, and wake up feeling more like themselves again. Now I want you to comment below: which habit will you change first tonight? Will you try left side sleeping? Will you gently elevate your upper body? Will you change your pillow? Will you eat dinner earlier? Or will you reduce screen time before bed? Your answer may help someone else recognize a pattern they have been ignoring. And remember, this video is for education and awareness only. If you have heart disease, high blood pressure, diabetes, lung disease, irregular heartbeat, sleep apnea, a history of stroke symptoms, or any serious medical condition, talk with your healthcare provider before making major changes. Every person,